Hey, my name is Frank Spatafor, and today we'll be going over the adult intake probation process and why I also think the probation process is important to rehabilitating offenders into normal society. To begin with, the original intake process will begin with a drug screening. The drug screening will show up any kind of drugs that the patient may have taken even up to a year prior to the drug screening. With the drug screening, normally we have a urine screen. If the patient doesn't have to use the restroom at the time, we usually inform them to come back to the day report center in future times, willing to, ready to use the restroom. Therefore, if they want to use the screen, if we need to screen them when they first show up, we can. But during the first process, if they're not ready to take a urine screen, what we'll do is we'll have like an oral swab, or sometimes we can even take a hair follicle if the patient's okay with that. After we have the initial screening, we have an LMI assessment. The LMI assessment is to score the patient and see the severity of maybe her drug abuse, his or her drug abuse, psychological abuse, like how maybe she is or he is mentally, how they were treated as children, where they grew up, the setting in which they grew up. Maybe a lot of the times, we have repetitive offenders that grew up in harsh households. And we write this stuff down. We all log it to make sure that we have this information to see any kind of repetitive spikes. And one that we see is that a lot of these offenders that we have are coming from troubled households. But our rehabilitation program really gets them on the right track. After the LMI assessment, the second day they would come in, of course, have some kind of drug screening ready for them at the door. And then, of course, we would go into some kind of therapy. Usually the therapy would go off the score of the LMI assessment. If they were going through a lot of trauma as a child and have a lot of past drug abuse, we will put them through more therapy than others at times. Some of our therapy includes being able to talk with a therapist one-on-one. You can do this anytime that the day report people come in. Anytime as our patient come in, you can always talk to our director, Brandy, or you could even talk to Misty, Melissa, any of the therapists, and we have interns as well there that you can talk to as well. On top of that, we have classes as well. Our classes are kind of like an AA class. That's kind of the way I would describe it. It's like a rehab AA class. We would go over, maybe some of the patients would go over problems that we have in our program, and we would go over with them maybe how we could make steps towards fixing that. During our program also in the classes, we teach the patients better ways to get ready for the community, how to make better decisions, not how to make decisions out of spite. We'll give them processes of thinking worksheets, which would make them think, what would you do during a time of something bad happening? Don't make a decision just real quick because you're heated. We make them think and go through the processes of logical thinking and making decisions that wouldn't affect them long term down the road and in the future. After we have the LMI assessment and they're scheduled for their classes, they would start beginning the classes. And it's a long road. Some of the patients that we have can be scheduled for probation for maybe even up to 2 to 3 years. And they would have to graduate through that 2 to 3 years. And if they are set backwards, they would have to continue the process and maybe even have a longer probation. I think that it's stern, the drug testing, the classes. Sometimes we're even made to give community service to some of the probation people we have, some of the patients that we have. And it's stern, but it's what it takes to have these people to start getting back on the right track and releasing them back into society. We've had good results. Over the past couple months, I haven't been here long. I haven't been at the Marion County Day Report Center long, but over the past 2 to 3 months, I've seen people graduate, and just over the terms of 2 to 3 months, I've seen them change, become more mature people, become a lot stronger human beings, being able to make way better decisions. It's very powerful and very good to see that the classes, the rehabilitation, the therapy, everything that we're providing these people is working for them. What we really try to do, our motto, the Day Report Center, is we just try to make it a second home for the people, maybe even a better home than they have originally. We try to get them away from the bad people and rehabilitate them and be able to put them in a good place in society, make them productive human beings in our society, and it's really making a turn for the better. I'm very excited to be a part of it, and I've learned a lot, and I hope you guys have learned a lot too about what we try to do with our patients at the Marion County Day Report Center. Thanks a lot. Once again, it's Frank Spatafor. It was nice talking to you.